So with that, I'm going to hand over to our panel. We're going to start with Kenya. It's my great pleasure to introduce NDUKU Kilonzo, the CEO of the National AIDS Coordination Council in Kenya, who's doing wonderful work. I know we're close partners. And after that, it's going to be Keith Grosen, who's the Business Development Manager from Philips. So NDUKU, please. You certainly may. Thank you.
Good morning, or is it good afternoon? Thank you very much for inviting me to make this presentation and to speak a bit. I'm going to focus on a few things. The first is what it looks like in country. So I'm going to be very practical in what's going on. Then I'm going to also look at the opportunities. What are the opportunities? And then lastly, I am going to look at where and what are some of the considerations that we need to be making as we talk about PPPs. In my presentation, I'm also speaking on behalf of Dr. Rashid, who wasn't able to make it here. So in my first slide, I want to start with the Big Four agenda, and this is the President's agenda, and it focuses on universal affordable health and universal health care. And the box there just gives you a sense of where it is that we want to go. In Kenya, currently, we want to be able to fill that little box into the big box. So in terms of services, in terms of access, and in terms of financial protection. So that's really where we want to go. And as we think about the private sector, I think the private sector needs to make the consideration about how and what are the opportunities. So how do we want to get there? There are three key areas with very clear strategic directions and critical drivers that have been identified. Coverage, access to services, and financing. I want to note that you will look at number 10 around financing, and it is attracting investments, private sector investments into the health sector. And whereas at the moment it may look like it is viewed as simply bringing in money, it is actually more about how can we leverage and utilize the private sector, and how do we quantify that into helping the country achieve the goals that we want to be able to achieve of universal health coverage. I thought it important to start with a sense of organization, because sometimes as we have these conversations, we talk as if it's a little bit of a vacuum, or not a vacuum, but we don't really think through when you want to engage, how do you start, where do you start, who do you engage with? And the health sector is organized under the Ministry of Health, and the Ministry of Health has the ministry's own departments that are outlined there. But also it has semi-autonomous agencies. Some are regulatory bodies, such as the professional bodies for the doctors, for the nurses, and so on. Some are state corporations, such as the National AIDS Council, where I'm the chief executive, and the Medical Supply Agency and the Institute of Research. So it is important as you start to think about public-private partnerships, because these are all gateways to engagement and to the way in which private sector can bring and leverage health services and the health infrastructure. So let me turn a little bit to Kenya's transitions as part of this background. And I was really interested when Dr. Pate talked about, or should they be called evolutions? The fastest one is obviously we are fast-growing economy, and we want by 2030 to be a middle-income country. I think the second is the question around population. If you think about HIV alone, if we just retain the sort of risk ratio that we have, or risk rates that we have as a country, we would double the numbers of new infections among adolescents and young people, who account for half of the total new infections last year, which were about 55,000 in Kenya. And therefore, just looking at that demographic is really important to figure out what do we need to do. Then we have, obviously, sort of epidemiological considerations, and we have we've had significant declines in child health. We've averted about 30,000 deaths per year over the last 2-3 years, 2,000 maternal deaths. Our new infections have fallen by almost 50% over the last 6-7 years. But that is HIV when you think about HIV, but we have a new challenge, and I don't need to speak about NCDs, and you can see this is the mortality related to NCDs vis-a-vis the contribution of mortality to HIV. So what do we need to do as a country? And if the private sector wants to come in, how is the private sector going to help us really turn this into the red line into the blue line? Because the blue line is a good direction. We are not yet there, but it's a good direction. How does the private sector begin to leverage to help us turn that? So having talked about just introducing the sector and just beginning to shape the thinking, I want to talk about what is the current status, and therefore as we start to think about the opportunities. And the first is with regard to quality of services. The private sector owns slightly more than half of health facilities, but most of these that are owned by the private sector, it owns more than half in numbers, but most of them are really the lowest level of facilities, clinics, dispensaries, nursing homes. Then, and that is when I say private sector, I mean for-profit and non-profit, because I think you can see faith-based organizations and NGO organizations are not-for-profit organizations. With regard to domestic financing, the private sector contribution, and this is where we put out-of-pocket expenditure, plays a major role in health financing, almost 60%. And we have a high reliance of on donors. You can see there it is slightly more than a quarter. But we have seen also that there's been significant increase in government allocations for health expenditure, and I'll talk about that. General health in total is an increase of about 40% between last year and 2013 and 2016, and then for HIV it's actually been a more significant increase of almost 30% in terms of total AIDS expenditure. When we think about the total amounts of money, and this is in Kenya shillings, to do a quick transformation to dollars, conversion, not transformation, divide by 100. So we are talking about, for instance, quite, when you look at the fact that we have decentralized, we have more money available across the 47 counties that is targeted at health. And earlier on, somebody talked about the fact that we have decentralized, for instance, procurement of commodities, and it is true, and health products and medicines. However, we have not decentralized what we call strategic health commodities. So we're talking about ARVs, TB drugs, HIV drugs, family planning, immunization, vaccines, and so on and so forth. That still remains central procurement. So what are the other resources available in the private sector? We have the NGOs, and in this case, this is just a routine report from the HIV Implementing Partners online reporting system, where there are 411 NGOs related to HIV work. But you will note that out of a report of the 52 highest who reported the highest expenditure, they reported an expenditure of $190 million in 1 year, the year financial year 16-17, sorry. And it's important to note that health workers and infrastructure is government-owned and government-paid, and commodities are centrally procured. So this is the money that is available for other services that are related to community mobilization, that are related to engaging people, to creating demand, and so on and so forth. So how can we leverage these resources? So I've given those two sets of backgrounds just to give a sense of, one, what the resource is like, how it is structured, how it is organized, two, to give a sense of how the sector is organized. So I want to then talk about some very specific examples about private sector engagement under the Ministry of Health. So this is a huge public-private partnership, and it leverages the private sector for various things related to product competencies, capacities, and it's a $1 billion program. And the implementation of the program started in 2014-15 over a period of about 7 years, and it involves supply of all manner of equipment, theater equipment, ICUs, radiology, in various facilities across the country. And you can see the contractors are very many different types of private sector. But we also have another side of private sector engagement. In this case, let me talk about the e-health project. The e-health project leverages competences. And in this case, we've had IT-related, technology-related companies provide electronic medical record solutions. And it is being tested in one county for a paperless system. But importantly, this is one of the remote counties. And it is the video conferencing that enables consultations across different doctors that seems to have become the most important part of this PPP. But it is not just about the hardware. It is also about software. Last year, the last 3-4 years, we had Her Excellency start what we call the Beyond Zero campaign. And what she did was leverage and get resources from the private sector who donated clinics. The clinics were actually a flagship because what they did was be able to help her engage mobilization of counties, engage healthcare workers, engage communities for conversations and create awareness and urgency around maternal and child health and with regard to, and what you can see there are some of the results we achieved between 2013, 2014 and 2016-17 with regard to prevention of mother-to-child transmission. We almost halved our rates of MTCT in the country. So, but that is central ministry, and then we have, sort of the multi-sector engagement such as Beyond Zero and the political leadership that goes with it. But we also have the semi-autonomous agencies that I talked about, and in this case I have taken 2 specific examples. The Kenya Medical Supply Authority, it is the national health commodities and procurement supply chain, and it has successfully transitioned to a business model where with government of Kenya Capital, it sells and charges to the Ministry of Health. So it doesn't actually get money from Exchequer anymore. And we have very many different people who are procuring now, including the private sector. So it has become in and of itself, as an agency of government, a business-run model. And therefore, what we have also seen, because it is used by donors, in Kenya we don't have, at least for the key commodities, we don't have parallel supply chains. We have one supply chain that is used by everybody. So whether you put in money or product into that supply chain. And that has meant that actually over the last few years with good forecasting, 4 years with good forecasting and quantification systems, we have not had stockouts of strategic commodities, as we call them. Then we have the National AIDS Control Council where I work, and we have the Kenya HIV and Health Analytics Platform. And this was an engagement with UNAIDS and a company called Livedix. So what we were able to do is develop a platform that utilizes artificial intelligence to provide visual graphics of any of the key indicators related to HIV. And I was just giving the little snapshot there on the side because that map you can zoom into it, zoom out of it, so that it can give you, where your indicators are working, what is not working. You can look at it on a monthly basis. So it becomes a very important tool for decision makers who don't have time to look at spreadsheets and try to interpret them. But importantly is also the fact that it draws data from 5 different agencies. And when I say 5 different agencies, there is the Ministry of Health, who are the service providers. There is KEMSA, who are the logistics and supply people. There is the community data system that is run by NAC. So it brings all of this together into a single format that allows you to be able to see where are we at on the key indicators on an ongoing basis. And this, again, is a private sector partnership. And so the question then is, and we are now expanding it to include RMNCH, and the discussions are what would it take to become what is utilized for tracer indicators for UHC or for tracking UHC, being that we have been quite successful, not without its problems, and is currently being considered for adoption by the AU CDC, by the Africa CDC as part of the observatory. So there are other very specific projects from some of the other agencies. Okay, I have 1 minute left. So we have the national hospitals, where you have much smaller private sector engagements, but also some quite big investments. So, for instance, multi-speciality hospitals and so on. So, I will move very quickly, and I will just say that with regard to areas for private sector engagement, the first obviously is if we are going to go financial protection, what are the opportunities for instance, insurance? And how can insurance companies or other companies really help? And we know we have examples from the financing sector that was able to be disrupted. We have access in areas of accessing quality and health services as part of filling in the box that I started talking about. There are opportunities in a number of areas, and I want to focus on the expansion of affordable healthcare services. We can have the idea of continued small clinics with enhanced quality assurance and accreditation, which, as we said, is part of what has been happening. But the second also is large-scale private investments where we have franchise models, but that can be scaled out across the country. And then the last item has to do with the expansion of having private sector provide things such as social impact bonds. I think they were talked about yesterday. Market-driven health commodities. It can invest in prevention. Should we be having condoms being market-driven and not necessarily public health driven, except for very specific places? And how does the private sector help the government transition to a more market-oriented commodities? Technology. I'll just take, for instance, if you think about diabetes, what do you call it? Diabetes diagnosis. And you review diabetes diagnosis. What about if this was IT-based and we didn't have a healthcare worker going to do blood testing and finger pricks to be able to do that? What would that do in terms of being able to capture people and refer them on phone? And is that something that could actually be done? So there are real significant opportunities that can be used by the private sector. So my last slide, if you'll allow me, has to do with the challenges and the considerations. And I think the first is, when we talk about domestic financing, what do I need versus what you want to give me? Half the time what we get is what people have produced, the private sector has produced, and they would like me to have. The question is, who has asked me what I need so that we can sit down? Because I think that would be a model that would give a win-win, so to speak. And how is country ownership defined? Crowding projects versus ideas to scale is a real issue. Funding mechanisms, we know from KEMSA, once we strengthened KEMSA, reorganized its governance, we had the political will to do that, we now have one national system. It means that even if anyone leaves, we may have the challenges in putting in the product, but the system for procurement and supply, actually, I believe that KEMSA gets better products for some of the commodities better than some of our global agencies in terms of price. Then we have business portfolios and attendant disclosures of interest. Sometimes we get challenges with people disclosing interest, disclosing what it is that they want in terms of business, what businesses want and what they expect, and how it is that then we are able to organize and negotiate so that it is a win-win, including for government. And then finally is the question, are we actually ready for change? If today we transited everything that we have and we said governments have taken it on, all of us who are sitting in this room would have to rethink our jobs. At the country level, would have a lot of people would have to rethink their jobs. Are we actually ready for it? And are we working towards it? And I know I've raised this before, but because it is one of the softest and talked about issues around the question of will we achieve transition, and will we be able to actually get private sector involved and driving and supporting the implementation by the health sector? Thank you.
Thank you, NDUKU.